My name is Rick Burrell. I'm the Director of Physical Therapy and Occupational Therapy here at Good Shepherd Healthcare System. You've just had a total knee replacement, and we want to show you some exercises that you can do while you're in therapy. You'll already be in therapy, but this is to help you once you go home and say, I don't remember my exercises. You can look at this video and see what you need to be doing. Following surgery, the most important thing is to restore your knee range of motion. To do that, we need to control the swelling and the pain in your knee. So it's critical that you ice your knee frequently during the day, and that frequently during the day, you also, go ahead and lay down, elevate your leg on a bunch of pillows. The knee needs to be above your heart for it to do any good. Okay? Some patients will use a lot of pillows. Some patients will lay on their couch and they put their foot up on the back of the couch. Whatever's comfortable for you, but just get that knee above your heart. Okay? Now, we want to talk about some stretches. One of the first things we think about is bending your knee, okay? But extending your knee is just as important. If we don't get your knee straight, if we can't get it all the way straight, as you get older, your knee will tend to not hold you as well. And if we don't get it all the way straight, there tends to be a little more ache in there than if you can get it straight. So getting it straight is critical. So what we want to do, you can go ahead and sit up, is put something under your heel, okay? And have you tighten the muscle here and try and drive your knee down, okay? You won't be able to tolerate this right away, but a few weeks after surgery, you can add a little bit of weight to that to help get that stretching. You want to do that no less than 3 times a day, but if you can do it every few hours, that would be great. Okay? Now, bending your knee. Let's go ahead and lay down. You want to start with some heel slides. So you're going to drag your heel up the bed and push it back out, trying to get the knee range of motion going. Okay, now go ahead and sit up. Another exercise we like to teach is you can do that in long sitting like this, like if you're leaning on the couch or sideways on the couch, or if you're leaning up against the wall on your bed or the headboard, you do the same thing. But this time, when you go out, I want you to think of pushing that foot out as far as it'll go and tightening that knee and driving the knee down till it touches the bed. Okay? Very good. You can lay across your bed and hang your leg off the edge and just relax and let it stretch. Okay? You may not tolerate this the first week of surgery, but after that, you should be able to do this. And if you really have a problem extending the knee, then we're going to instruct you to add some weight to your ankle. Whether it's a shopping bag with some canned foods in it that you're hanging around your foot, so that when you're laying down, you've got a little bit of weight there, helping to assist straightening your knee. Next, we want to show you how to stretch your calf. You could do this in your walker, but it works better if you push your walker up to a counter and you're holding on to the counter. Okay? You're going to put your affected leg back behind you, knee straight, and you're going to stretch your calf as you lean forward. Okay? Good. Next, you're going to bring this foot up to next to the other one, and you're going to go up on your toes and do some heel raises to exercise that calf. Okay, very good. Now let's sit on the bed here. Now to work on bending your knee, you can sit down in a chair and try and pull that foot back, okay? If you have a slippery floor, you can sit in a chair. You can do some heel slides, going back and forth, getting that knee moving, pulling it back. And after a few weeks, when the pain starts to subside, you can then sit in a chair, use the other foot to cross over and pull that foot back and start stretching. Hold it to the count of 3 to 5 seconds and then let it up. Let it rest a few seconds and then go again. Okay? Now, the other thing you can do sitting in a chair is, if you don't have a chair that's a floor that slides very well, is you can scoot forward in your chair and make it bend. Okay? And once that gets easier, then you pull your foot back a little bit and then you slide again. And you can do it that way as well. Now we want to show you another way that you can passively stretch your knee into flexion, and that is with some TheraBand. Your therapist can give you some of this, and you'll bend your knee back as you're pulling forward on that, trying to get that knee to bend. Now, typically this will be going underneath the chair and coming up the back of the chair, so the leverage will be better. Another exercise that we want you doing is with some TheraBand. And you're going to wrap the TheraBand around your knee, but you want a towel in between the TheraBand and your knee. Okay? A thicker towel would probably be better. And you're going to attach this to something in front of you, and then you're going to extend your knee against the resistance while you're just standing there. Next, we want you working on sitting to standing. So you're going to stand up, sit down, and you can hold on to your walker and sit and stand and sit. Your goal is for 10 repetitions. And then rest. And if you have more energy, you can do another 10. Okay? Now you can start doing the squats. Let's go ahead and stand up in your walker as well. So go ahead and squat and come up. Good. Okay? And then we want you to work on your balance, standing on one leg. Now, if you have poor balance, you may not want to do it in the walker. The walker is fairly stable, but what we want you to do is actually pretend this is a kitchen counter. You're holding on. You stand on one leg. Now let go of the counter, and then grab the counter, and see if you can get up to 10 seconds on one leg. And you're going to do that on both sides. For this exercise, you're going to put your foot up on a stair, typically on the second step, and then you're going to work on bending your knee as you lean forward. Okay? And once that gets easy, you put it up on one step higher, and then you can lean a little further, and that'll bend your knee a little more.